Hey guys, thank you for tuning back into my channel. It's Lex Shelby here. Today I'm going to be discussing anxiety. I know that with everything going on, everybody's anxiety is probably at an all-time high. And actually in this moment of crisis, that is actually pretty normal. But I want you guys to know exactly what anxiety is, and I want you guys to know techniques and your triggers for you guys to be able to deal with anxiety, alright? So let's get to it. What is anxiety? Anxiety is a mental health disorder characterized by feelings of worry, feelings of negative thoughts that are strong enough to interfere with daily activities, okay? So we don't need our anxiety interfering with our daily activities. So what do? Are there different types of anxieties? How can I get through the different anxieties? There's social anxiety, there's situational anxiety, there is free-floating anxiety, and there is just a general feeling of anxiety, just always nervous, always anxious. You can experience chest pain, flushing skin, racing heart, like you're losing your mind, chills, lightheadedness, hot flashes, numbness, and tingling. That's what always used to happen to me, and I used to think I was having a stroke. On that note, story time. So, I had my first panic attack when I was about 9 years old, and I did not know what was happening, but I felt that I was dying, and I ran to my mom and I was like, "Mom, help me, please, something's wrong." And she grabbed me and put me on her lap and sat on the steps and said, "Baby, you are having a panic attack. What triggered it?" And from there, 9 years old, my anxiety started, and I would always have anxiety. Like, I've been to the emergency room like with stroke symptoms, and they have told me like, "You are having anxiety," gave me some medicine and sent me home, you know? So I've been dealing with anxiety all my life. That probably is one reason that triggered my drug use. You know, you never know, did the chicken or the egg come first, you know? So I've been dealing with anxiety for a long time, and what helps me out is ADML. That means accept, do, maintain, and learn. Accept you're not in control of anything, do your best, maintain a positive attitude, and learn your triggers. Triggers. Do not be in a trigger zone. Y'all know I'm very big. Anything that triggers you, you have to let it go or learn how to figure out your triggers, what irritates you, what puts you on edge, what gives you the anxiety, what makes you nervous, what makes you anxious. Write it down, figure it out, deal with it. Treatments for anxiety, self-care. What is self-care? Some people need to avoid alcohol, reduce caffeine, exercise, relaxation techniques, stress management, and a healthy diet, okay? Those are some self-care treatments. Some people use medication, SSRIs, nerve pain medication, things like that. I'm not going to tell you to use that because I am clean, but there is something that I like called Calm, and you pour it in a water bottle, and it is a natural substance that you're able to relax yourself, okay? Other things that you can learn are counter conditioning. What is counter conditioning? Counter conditioning is a technique employed in the treatment of phobias and similar conditioning in humans in which behavior incompatible with habitual undesirable pattern is induced. So meaning patterns that, like negative thinking, how to turn it into a positive thought. Reframing is expressing issues differently than the way you said it. Like, instead of saying negative, "Man, I gotta get up and go to work today," a positive way to do that is, "I get to get up and go to work today," you know? So reframe anything that you're gonna think negative, counter condition it and come back with something positive. At the end of this video, I will have an exercise for you guys to show y'all how to have anxiety and how to reframe it and get a positive outlook on it. So another technique is stimulus control. Stimulus control is a phenomenon and operant conditioning that occurs when an organism behaves in one way in the presence of giving stimulus in another way in its absence. So a way to do this and why stimuli is important is because if your brain starts thinking about something, if you learn how to control that behavior, your brain won't think those things because your stimuli control is going to reverse it, okay? So it's all about changing and reframing the way that you're thinking. Put yourself in that moment. If you're having anxiety, count to 30 seconds, okay? Your heart's beating fast, you feel like you can't breathe, count it in 8 seconds, breathe it out 4 seconds. Do it over and over again. See something on the wall and keep looking at it until you calm down. Exercise to do for anxiety and how to reframe. So you can draw an X like this. And then on one side, write anxiety. On the other, write reframe. And then whatever your anxiety is, like that, whatever your anxiety is, write it right here and try to reframe it with a positive thought. Like I said earlier, if you put right here, I have to go to work, reframe it and put I get to go to work. Or, oh my God, I gotta lose weight. You can reframe it and say, I am going to lose weight to live a healthy lifestyle. Again, guys, thank you for checking out my channel. I am Lex Shelby. Recap really quick. Anxiety is just a fear of impending doom, always worrying negative thoughts. Symptoms, heavy breathing, feel like of impending doom, feel like you're gonna fall out and die. Treatments of this is self-care. Think about yourself. Count to 10. Ways to limit your anxiety is ADML, accept, do, maintain, and learn. I hope I taught you guys something in this. Remember, stimulus control and counter conditioning. Always turn the negative into a positive. If you guys have any comments, please let me know. I hope you are all staying safe during this time. Please like, share, and subscribe, and I will see you guys next time. Thank you for watching this video, guys. Peace.